Governor Mary Fallin announced on Monday Oklahoma will not develop a health care exchange under the Affordable Health Care Act. States that do not develop an insurance exchange will have one set up for them by the federal government. Governor Fallin also announced the state will not expand Medicaid. Currently, Oklahomans have to fall in specific categories to be eligible for Medicaid. Under the Affordable Care Act, the state could broaden the eligibility requirements.
Our priority in Oklahoma has been to ascertain what can be done to increase the quality and access to health care, to contain costs, and to do so without placing an undue burden upon our taxpayers in our state. I have stated many times that it is my firm belief that PPACA or Obamacare fails to further these goals and also will in fact decrease the quality of health care across the United States while contributing to our nation's growing deficit and debt crisis. Despite my ongoing opposition to the federal health care law, the state of Oklahoma is legally obligated to either build an exchange that is PPACA compliant and approved by the Obama administration, or the option is we can default to an exchange run by the federal government. The choice has been forced upon the people of Oklahoma by the Obama administration, in spite of the fact that voters have overwhelmingly expressed their opposition to the federal health care law through their support of State Question 756, a constitutional amendment prohibiting the implementation of key components of the PPACA law. After careful consideration, I have today informed in writing through a letter to the U.S. Secretary of Health, Kathleen Sebelius, that Oklahoma will not participate in the creation of its own health care exchange.
Governor Mary Fallin's annual food drive exceeded its goal of 1.2 million meals. This year's Feeding Oklahoma Food and Fund Drive will provide 2.3 million meals to support the Regional Food Bank of Oklahoma and their partner agencies. The third annual drive concluded on November 15th.
We started this food drive 3 years ago. When I became governor, I said not only do I want to go through the pomp and circumstance of becoming a governor, but I wanted to do something that would give back to the state of Oklahoma in a meaningful way and to address some of the pressing issues of our state. Besides the governing part, there are a lot of people that do suffer in the state of Oklahoma. So all this wouldn't be possible without the help of many, many Oklahomans, and certainly without the help of a leadership team that we put together to organize this statewide food drive. All in all, I think we had 114 companies that participated, which is a large sum. And then we set a goal that we hope to beat. Last year, we raised 1.2 million meals for our fellow Oklahomans, and so we set that goal again this year. Actually, we set a goal of 1 million meals. Last year we beat it by 1.2 million, so this year we upped it to 1.2 million. So here's the results of the 2012 food drive. We had the goal of 1.2. I am pleased to announce that between the money and the food that was donated, we have raised enough meals for 2.6 million meals. More than double.